back to my channel. I am Ava. I'm a registered nurse, and in this video we are going to work a shift as a inpatient virtual nurse. So basically I'm still a nurse that sees patients in the hospital, just virtually. So today I'm only working a short shift. I'm working 11 to 3 because my nephew has a birthday party today. It's at 5. We're gonna go, but I still want to pick up a shift for the time and a half and the shift if we do get a shift if on the weekend. It's Saturday, so I'm gonna work this shift and I'm just gonna take y'all along with me. And so let's get started. I'm already mostly ready. I got my lashes, edges, hair is already done. I'm gonna change my shirt. I still have to wear my scrub top because the patients and the nurses can see me on the unit. I know I'm at home, I still wear scrubs. I know, but that's the rules, so I'm gonna just do that. Put my scrubs on, and basically I'm like the discharge nurse, I'm the admissions nurse, I'm the rounding nurse. If a nurse needs a med sign off on like heparin or insulin, blood, I'm the nurse for doing the sign-offs. I'm the rounding nurse. I'm the educator, like I'm the nurse that goes around educating patients on different things on the unit. So there's a lot of different things going on in the role of the virtual nurse, but that's kind of what I'm doing today. And my coworkers are already working. I'm just another, like a virtual float nurse, just helping out. So let's go ahead and get situated and get started.
Thank you so much for watching this video. I just wanted to introduce you to the remote nurse staffing agency, Nursey Connect. This is a staffing agency that specializes in placing remote nurses. Roles we're looking to fill are inpatient virtual nurses, psychiatric nurse practitioners, and remote nurse case managers. You can submit a resume at nurseyconnect.com. Nursey Connect also offers virtual nurse training for nurses who want to get into inpatient virtual nursing. They do offer a continuing education course, and upon completion, you will earn a certificate to use on your resume. Link is in the description. Back to the video.
My daughter is sleeping. She's gone. All right, y'all. It's time to start the shift. So I'm about to just sign into everything, sign into my patients. I already see my assignment. I have 16 patients. I'm splitting the unit with 2 other nurses. So I have 16 patients. I usually see patients on med-surg units, and that's all the patients that I see. Usually I like to start my shift just opening up and see what tasks, well, since I'm floating today, see kind of what tasks are due. So right now I see there's like 2 admissions from night shift that need to be addressed. It looks like I might have to call the family, and there's another admission here. It looks like we just need to call this patient. So let me just back up. How I like to do my shift, how I start my shift. So I already know what unit and what hospital I'll be working on the day before my shift, or I'll come on to shift and I'll see that I'm working on a med-surg unit, and I'll be working with 2 other virtual nurses, and we'll split the assignment, 3 ways. That's how I ended up with 16 patients today. And then for all those 16 patients, I'll go ahead and log into the EMR I'll be working with today. Today I'm using Epic, so I'm going to log into Epic and just look at my patients, kind of see what they're here for, the plan of care. So I'll do a quick chart review, just kind of see, like I said, their diagnosis, what the treatment plan is, and if they have any plans for discharge, and if there's any outstanding admission items or medications that still need to be review with my patient. I've also already gotten handoff too from the nurses that are already working. They're like, hey, this is what we got going, because I'm coming in like halfway through the shift. This is all that we're working on right now. So the tests that are going on right now is mainly discharges, because it's like 11-ish, and that's when a lot of providers start putting in discharge orders, like 10-11 a.m. So once they start putting the discharge orders in, the virtual nurse is responsible for getting the patient essentially ready for discharge, as far as like getting their discharge paperwork together. Everything else, like the in-person stuff, the bedside nurse still does, but the virtual nurse kind of helps support with the discharge by getting the discharge packet together and then reviewing the discharge with the patient. So anyway, that's how I like to start my shift. So let's go ahead and get started. Like I said, I have 16 patients. So it looks like the patients I've signed into, there's a few patients with a couple pending admissions. It looks like maybe like 2 people need their admissions done. So for an admission, the virtual nurse just calls in and we ask them the questions on the admission form. So we go over like vaccines, medication history. We go over medical and surgical information. We go over pretty much everything we need to know about the patient to care for them. If they smoke, if they drink alcohol, we ask them all those questions. And we ask all the patients in the hospital every time they come in. It's kind of like a required admission form. And then providers and then other like nurses and everybody looks at that form, you know, especially if a patient's going to surgery and things like that, kind of what, you know, what they have going on. So we're going to call into this patient's room and we're going to knock this form out. Okay. So let me go ahead and get everything ready. Let me go ahead and learn about kind of what's going on with this patient and we'll get started on this admission. Okay, so called in, we got our admissions done. An admission usually takes about maybe an hour. Well, it takes about 45 minutes to do an admission in its entirety and its completeness. And I did 2 of those and now it's already like 12:30. So it just took the time. But anyway, the admissions that I just did, we had a patient come in from a nursing home with a UTI. That is so common. Came in for the UTI, had some confusion, but family was at the bedside. So I just called the family. I just called into the patient's room. I popped up on the screen. I was like I tell them it's like a FaceTime call with your virtual nurse or with your nurse. And I just asked them all the questions that we need to know about the patient. And then after that, I had another patient. He had like a, what's that thing? Like he had like a tonsillar abscess that had to be drained. And he's post-op, like he just came from the OR, but he still needed his admission assessment done. So I called in and I spoke with him. Very young, maybe like 21, super young. So his admission really, it didn't take that long because when they're that young and healthy, the admission doesn't take that long. He didn't take a lot of medications at home. He didn't have a whole bunch of comorbidities. He didn't have a lot of surgeries before. So the admission was pretty straightforward with him. But on admission, most of the time it's the patient's first time ever interacting with the virtual nurse. So at first they kind of like, they hear a voice, but they don't see your face and they looking around the room like, what do you need? Who is this? You know, and I'll tell them, hey, I'm the virtual nurse. I'm just going to come on the TV, you know, just let me pop up on the screen. And they're like, okay, whatever. I come up on the screen and they're like, oh, what is this again? What? I had a few people ask me if I was AI. I'm like, no, not yet. But they were like, are you AI? I'm like, no, I am RN. I'm a nurse. I'm just not physically here with y'all, but I'm still a nurse. You know, you can put my nursing license, clock you, okay? But anyway, yeah, they'll always say that and they'll just be looking like, oh, okay. And then I explain it to them. I'm like, hey, I'm just like an additional nurse virtually that's helping, you know, do things like the admission assessment now, and when you get ready to leave the hospital, I'll help do your discharge, answer all your questions, and I'll come and I'll check on you throughout the day to see if you have any pain, any questions about anything, and I'll update you, you know, about the plan of care. And then when I explain them like that, they're like, oh, that's the virtual nurse. Okay, thank you. How do we get in contact with you? And right now, I know some places you can press the call bell to get in contact with a virtual nurse, but unless they're specifically requesting get in contact with me, it's just whenever I call them. So but yeah, so we've got our admissions done. Yeah, I told y'all it was like prime time for discharge. There are a few discharges that are in the works, but some of my patients are still waiting for a few things. Now, when a doctor put a discharge order in, that doesn't mean the patient is ready to go that second. If you ever worked in a hospital, then you know, like, the patient could be waiting for a DME or a bed placement, or they have an adverse event at discharge, and then we have to cancel the whole thing. So yeah, so I see that I have a few discharges available, but they look like they're not quite ready yet. But so I'm not gonna mess with those just yet. So now, since I'm caught up on the admissions and my discharges are just kind of not quite ready, I'm gonna start rounding on my patients. So I'm just gonna call into my patient's room, see how they're doing, look over the provider HMP and see if there are any pertinent diagnosis I need to be aware of, and then kind of look at the chart to see if there's any updates on the plan of care. if they have any questions about anything. This is a big time where I do a lot of education. So, you know, if a patient has a new onset of like AFib, I'll go in there, I'll share my screen with like the hospital approved education they have, like an Epic, and, you know, I'll just talk them through, you know, what's happened to them, their diagnosis, you know, if they've ever heard of AFib, and we'll go through like the signs and symptoms and risk factors, things like that. And the patients, they really appreciate that, because, you know, 9 times out of 10, when the patient is in the hospital, they have no idea what is going on. They're hearing all this different lingo and diagnosis, and they're like, the doctor said I had it, but I ain't know what it meant. So, you know, having a virtual nurse kind of come around and just like close those gaps, that's really helpful. They appreciate that. So that's what we're gonna do right now. We're just gonna start rounding and doing some education on our patients. It is almost 1 o'clock, so we still got a few hours to work. So let's go ahead and just do some rounds. All right, if y'all made it this far in the video, I'm proud of you, because I can't really show you my screen because, you know, HIPAA and all that stuff. I can just tell you what I'm doing. And if you stay light in this part, thank you, because I'm just trying to let y'all know, you know, what virtual nursing is, kind of, you know, give you some information about it. But anyway, so I just finished rounds. Well, I was trying to finish rounds. I got notified to do a couple discharges, and I did. So what they looked like was, I called into the patient's room and we reviewed everything, as far as like where to pick up their new medications, and we reviewed pneumonia. This is her first time having pneumonia. So I really went into detail, you know, when to come back to the emergency room, signs and symptoms that it's getting worse, take your antibiotics, you know, the whole course, and just things like that. I went through the discharge teaching with her, and I just documented what I did in Epic, so the rest of the healthcare team know that the virtual nurse was in there. So now it is like 1:30. Y'all, this shift is moving, it's flying by. I really enjoy working this position remotely as a nurse, because number one, it's very low stress. I mean, you still got to keep up with things, but it's not like at the hospital, you know, where it's just like it's always something. And then I also like that I still get to be a part of bedside care without all the drama and all the issues. You know, I get to focus on being the nurse, like in this position, like, because I'm not in the hospital setting. Like, nobody can, you know, I don't have to do 5 other people's jobs. I'm just doing my job as a virtual nurse, and that feels so good. I can really focus on delivering like quality nursing care without, you know, all the extra things. You know what I'm saying. If you've been a nurse in the hospital, you know you wear more than one hat. But in virtual nursing, like, you wear your hat. Okay, you wear your one hat and you wear it very well. Like, you're that nurse, because you're just focused on your nursing aspect, right? Which is really nice. That's super refreshing for me. And then I'm gonna say this until I'm blue in the face. I don't care what nobody say. Nursing is a top tier profession, because I still get to work from home 3 days a week, 12-hour shifts. I don't know any other profession that's letting people work from home 3 days a week. I'm sorry. Y'all, if you're not a nurse, you're not cut from that same fabric. I'm sorry. You're just not. You don't have the same opportunities, you know? And I went live on TikTok the other day, and I was talking about some of the struggles that I had as a nurse, you know, in my career. And somebody commented, you know, they're like, oh, I should just go to be a rad tech or radiology tech or whatever. You know, I knew I should have picked being a radiology tech, you know, like, you know, that's better than nursing. And I was like, well, hold on now. Hold on. I might be struggling right now, but nursing, you can do whatever you want, whenever you want, however you want. You know, if I get tired of doing virtual nursing, I can go back to the bedside if I want to. I don't even know why I just said that, because that's not even in my, I don't know why I said that, because that's not even in my plans, but y'all know what I'm saying. If I want to switch specialties, I could. Right now I'm doing med-surg. Tomorrow I can go apply and be an OB nurse, get the job, work the specialty. If I get tired of doing that, I can go work in the ICU. I can go work on a burn unit. I can go work across seas as like an international nurse. Like, nursing is so freaking versatile, and I'm slowly learning this. You know, I've been a nurse for 3 years, and when you're working or when you're in nursing school, you just see the hospital bedside. But it's ever since I worked as a virtual nurse, or started working as a virtual nurse, it like made me realize there's so much more to nursing than just being at the hospital. So
no shade to radiology techs, but y'all can't just switch and be a different type of radiology tech. I don't even know how that works. But you know, in nursing, you can really switch it up. You can do what you want to do. Like, you can mix and match your income as well, right? Because I know some of my coworkers I work with now as a virtual nurse, they work PRN at the hospital, but they work full-time as a virtual nurse. So they're getting, you know, the best of both worlds, really, working in person and remote, I guess. But it's still maximizing your income, right? Because when you work in PRN, you making at least $50 an hour for the most part. And then the whole like nursing can really change with your life. You know, when I was working at the bedside, I was pregnant with my daughter, but I didn't have her. And then when she was about 8 months, I got into remote nursing. And I didn't realize that's what I needed with my life, because I was struggling at the bedside, like trying to be a mom. I'm a newer nurse trying to get things done. And it was like, even though I was still working 3 days a week, it was still like kind of a strain on my life, just trying to get it all. But then I found about virtual nursing, and I was able to like adjust my job to what I really needed in my life. And I needed to be home with my baby, I felt like, just to make it a little bit easier for me, you know. And so far it's working. And when my daughter goes to school, I can pick back up and do something else. I can keep doing virtual. Like, it just, if I have another baby, I can still stay remote. Like, it just really, nursing, you can really make it go well with your life. Like, you really can. I'm sorry, that was my little rant for nursing. Okay. Y'all, for the most part, we are caught up on task. There's probably like 30 minutes left in this shift. Unless I get another admission or anything like that. I help my coworkers out quite a bit. I helped them with their rounds in education too, and they had a few, they were swamped with admits, and I got in there and helped them out with those as well. And now I got a little bit of downtime. And that's the thing about virtual nursing too. It can be like boom, 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 super busy, but then like it can just be like lulls in the shifts, you know, where it's just like you don't really have to be, you know, by the computer as much. So I guess with that being said, I'm gonna take a step outside, just because we've been in here for a while. So let's go outside and breathe some fresh air. All right, we're outside. It is so breezy. It feels so freaking good. It feels so freaking good. And oh, it feels so good out here. I can't wait to get off work so we can go celebrate my nephew's birthday. And oh, we gotta go sign up on some blood. Come on, y'all. We just got a notification. So excited. Let's go. Hold on. Let's go sign up. Let's go sign up on this blood. Let's go. Okay. So I'm excited. I really enjoy doing medication sign-offs and stuff when the bedside nurses call for me. So what this is about to look like, I'm about to call in the patient's room, and I'm going to use a camera to sign off on blood. Okay. I'm about to look through the chart a little bit to see the indication for the blood. Look at the patient's hemoglobin to see if it's appropriate, and I'm going to pull up the blood policy just to make sure we follow all the steps. So exciting. So hold on, I will get back with y'all because I can't show y'all this. I'm sorry. I'll get back with you. Okay, the blood sign off is done. Okay, yeah, the blood sign off is done. So like I said, the bedside nurse can put in a request for the virtual nurse to come do a dual sign off, and that's what just happened. So I got a notification to my watch because I have an app on my phone too that also notifies me. That's also how I get to step away from the computer, because as long as I have my watch on, I'm not gonna miss anything. So anyway, so they're calling me to sign off on blood. I signed off on blood with a patient with what they suspect may be a GI bleed. So I looked through her chart and everything. Hemoglobin was less than 7. I also made sure we had the typing screen. The typing screen is only good for 72 hours. So tomorrow they'll have to draw a new typing screen. And then I also went and pulled up the blood policy, like I said. So the blood policy, it just lays out exactly what you need to do when you are about to administer blood and doing the blood sign off with another RN. And so I had that put up on the screen so the bedside nurse could see my screen with the blood policy. I can remote into her computer and sign off. So what it looked like was I zoomed in to the patient's blood bag. On the blood bag, it has, I'm holding a bag. On the blood bag, it has everything that you need to verify, okay, that you have the right patient, the right donor type, or if it's a donor type, you have the right like, I guess, bag number, and you have also like where the blood was from and everything like that. Okay, so, and the only way you can confirm that the other person can see that is if you do a verbal recall. So I had to recall all that information, just being able to see it, and I was able to see it all. And I had to verify her blood band. So she showed me her blood band, and I had to read off the numbers on the band, and the numbers on the band should have matched the numbers on the bag, and if it did not, we would have to send it back. But everything matched. So once we decided that everything matched, you know, we both did the feedback or the verbal feedback. I remoted into her computer and I put in my credentials and I signed off. And I was basically saying I was the witness to say that this blood is appropriate to administer. Now, once the blood comes up to the unit, you have 30 minutes to hang it. So that's why I had to go ahead and get in here and sign off on the blood, because they had already brought it up from the blood bank, and so they were ready to do the sign off, which was fine. I was available, so I'm glad I was able to do that for them. I would have really loved to have a virtual nurse when I was working at the bedside, because the hospital I was working at, you had to have somebody sign off on your insulin, all your sliding scale insulin. And y'all, I had the most, almost over half my assignment, my patients were ACHs, and most of the time they needed insulin. They were diabetic, they needed insulin. And every time they needed insulin, I had to get another nurse to come verify everything. And the unit was so big, you look down the hall and you don't see nobody. And imagine having to do that for 3 or 4 patients out of your 6 patient load. I mean, that kind of clogs up your workflow. You're probably spending a good hour of your shift just waiting for nurses to come sign off with you. But if I could have just called a virtual nurse, hey, I'm about to go in room so-and-so, I'm drawing up this insulin, come sign off, could have got through tasks a lot faster. But anyway, and I get so excited when I do the sign-offs, because like I said, you still get to be part of bedside care, and you still have to use your critical thinking, right? You have to make sure what's going on makes sense. That's why I check the hemoglobin, that's why I check the typing screen, all of that, the indications for the blood transfusion. But yeah, I was excited to do that. And I really enjoy supporting the bedside nurses, because I know what it was like to be a bedside nurse. And I want them to know that, you know, that's what I'm here to do. I don't mind. Whatever you need me to do as a virtual nurse, I'm in there doing it. Anything to make your shift go by a little bit smoother, call me, text me, let me know. Okay, so I know I said we probably had like 20 minutes when we went to go sit down. Yeah, it's the end of the shift. So what I'm going to do is I'm going to leave a handoff. So I'm going to leave a report on what I did and did not do. And I'm just going to leave a report to the other 2 nurses that are still working on the floor. So basically, we're pretty much caught up on everything. We don't have any pending admissions, no discharges that are due, well, for now. And I'm pretty much caught up on my rounds in education until the next rounds open up, which I won't be here for, but I'll just kind of let them know, make a quick little note and let them know, like, hey, I'm leaving. Boop, boop. That's virtual nursing. The shift report for virtual nursing is not nowhere near as tedious and long as bedside nursing. It's because it's virtual. So our shift is officially over. And now usually I work 12s. I usually work 3 12-hour shifts. I picked up a shift because we got a differential today and it was time and a half. So I was like, you know, get a little extra money. But I usually work 12s. I don't work 4 hours all the time. I am a day shift virtual nurse. So I work from 7 a.m. to 7 p.m. I absolutely enjoy working day shift. Night shift, I did work a few night shifts as a virtual nurse. It was straight. It wasn't as busy at night, but it was a lot of admissions, I will say. So day shift virtual nursing, you have to do a lot of rounding, a lot of education. They call you more for things like skin sign-offs or med sign-offs and skin checks, and like it's just a little bit busier during the day. But night shift, like, you're the admissions nurse basically. You're doing all the admissions that come on the floor. Sometimes you're on multiple floors, but you're doing all the admissions for the most part. Like I said, it was okay working night shift. Again, I really enjoy this position because I work 3 days a week, and I can't do the 5s, y'all. I'm sorry, 5 days. Ever since I've been a nurse, I've only been working 12s. That's all I know. That's all I ever want to know. Just because once you start working 12s as a nurse and you try to go down to the 5s, it's just like, when can I go to the grocery store? When can I go to the doctor? Like, and then with me having a little one with me most of the time, you know, working 3 days a week is so helpful. You know, I know she get cabin fever being home with me and my sister all day, but so it gives me time to get her outside and just plan my life, you know. I like that I spend less time at work than I do, you know, I spend less time at work when I'm working the 12s. And I work the same shift at the bedside. It was just, the workload at the bedside nurse is just exhausting. I was just so tired, you know. Yeah, I worked 3 days a week, but I was so beat up. So beat up. It was so exhausting. But with doing this 3 days a week, I still got energy. I'm going to a birthday party after this. Like, I'm a different person working this. When I was working at the bedside, it was changing me, and I don't know. I was like, dang, this is what I got into nursing to do. Like, this is how I feel being a nurse. You know, I was this close to be like, if this is nursing, I'm out. Like, bedside nursing really, you know, for my first taste of nursing, it didn't really leave a good taste in my mouth. I'm glad I did not quit on nursing, because I would have never found out about this beautiful thing that is called inpatient virtual nursing, and had the opportunity to, you know, still, you know, be a mom, work on the motherhood aspect of it, and still, you know, be a professional, still working as a professional in my career field, which is super, super, super rare and super exciting, right? I'm just grateful for the opportunity and to be able to share this opportunity with you all. I know a lot of us nurses are looking for things beyond bedside nursing. What can we do with our nursing license? Where can we go? Who can we be? And virtual nursing is one of those things. If you're, you know, just looking to get out of bedside or drop down to part-time or PRN at the bedside, which a lot of people have done, a lot of nurses have done. And you just want to see, you know, what else is out there. Inpatient virtual nursing is real. It is a thing. A lot of hospitals are starting to adopt it because it works. Having a virtual nurse come in and do this virtual care, the patients really appreciate it, and the bedside nurses really appreciate it, as far as like the workflow and everything. Now, as far as the pay is similar to bedside nursing. That's why I ended up switching, because when I saw the pay, I was like, why would I still be working in the hospital when y'all pay me the same thing to work from home? I used to make, when I first started working at the hospital, I was making $30 an hour. And then we did get a raise. And then I was making about $35 an hour working in the hospital. And then I found out about virtual nursing, and they were offering $31. I make $32 now. And I was like, to me, it was like, y'all kind of offering the same thing. I mean, I don't have to pay for parking. I don't have to leave my kid. Like, I'm gonna do virtual nursing. And there's opportunity for you to make more money too. Like, virtual nursing is kind of set up like bedside nursing. So you still have your shift diff. You still have your like overtime. You could pick up shifts like I did today. You can still get your time and a half. Yeah, it's still money to be made, you know, doing virtual nurse, if that's what you want to do. You can add, you know, you can work another job and be a virtual nurse. It's just whatever you want to do. Okay. Right now, I'm just doing this full time. So, well, I'm not just doing this full time. I'm also the chief executive and the founder of the remote nurse staffing agency, Nursey Connect, where we look to place remote nurses. Inpatient virtual nurses is one of the roles we look to fill, along with remote nurse case managers and psychiatric nurse practitioners. Okay. If you want to learn more about Nursey Connect, you can head over to nurseyconnect.com. We also launched a inpatient virtual nurse training as well. So if you enjoyed everything that I did today, working as a virtual nurse, you want to learn more about it, you want to get training on it, I will link the training in the description below. And that training is a 1-hour continuing education course, okay, that you can take, and after you take it, you'll get a continuing education certificate for inpatient virtual nursing, and use that on your resume for future job opportunities. Okay, so not only am I willing to train the nurses, I'm also placing the nurses through my agency as well. Okay, All right, last thing, y'all. I also run a podcast. It's called the Nursing Connect podcast, where I sit down and I interview different types of remote nurses. I know a lot of y'all that have clicked on this video or watching this video are looking for different remote nursing opportunities. And I sit down and I just ask these nurses, what do you do? Oh, how much do you make? What's your life like? And so far I've interviewed a virtual ICU nurse, inpatient virtual ICU nurse. So she does the same thing I do, but in the ICU. I also interviewed a psychiatric nurse practitioner, and baby, when I tell you those nurses are getting paid, okay? You want to listen to that episode. I also interviewed a remote nurse case manager. I just interviewed like a director of nursing for like a virtual nursing AI company. She kind of talks about, you know, her role and what she does there as a nurse, and she gets to work remotely. I also interviewed another nurse. She helps out with remote nurse resumes. Her name was Jennifer Myers. She helps nurses build their remote nurse resumes. I interviewed her. Her episode was up. She's on TikTok too as Jen Myers. And she helps nurses rewrite their resume. She talks about in the episode tips about how to write your resume, you know, for remote nurse positions, the whole nine. So that was a good episode with her too. So the podcast, super informative, especially if you're a nurse looking for remote working opportunities. Just trying to get your foot in the door. So definitely listen to that podcast, because a lot of the guests, they leave their contact information and they want the nurses to reach out to them and ask them questions. You know, networking really helps you get what you want in nursing and where you want to be. So listen to that podcast. Also gives you opportunity to network if you want. Right. I'm so glad that y'all tuned into this vlog. I love making these. I love talking about virtual nursing. I enjoy being a nurse. So if you enjoy my content, go ahead and like this video. I'm also on TikTok. I will link everything down in the description. Yeah, so thank y'all so much for tuning into this vlog. Happy nursing. Bye.